Hi, this is Jessica from Nervous System Reset. And this message in particular is really geared towards healthcare providers, mental health therapists, all healthcare providers who, in the press of the recent world events with coronavirus, are finding themselves in the position of switching their in person practices to web based or telehealth practices. So I want to say first off that it's a miracle that we have the capacity to interface digitally in a way that allows us to continue to be of good, valuable support to our clients and patients. So that in and of itself is an amazing thing. And based on the last couple of weeks of talking to clients, and I work with the general public, I also work with lots of professionals. One of the things that I've seen over and over and over again are folks who are now doing sessions via video conference and who have gone from in-person practices to web-based practices overnight and are feeling the strain of that conversion. So I thought it might be really helpful to just put out some thoughts on this because I have a web-based business. I've been working via video conference for 7 years now, and I've been doing all of my work exclusively via video conferencing and online formats for the last 4 years. So I have a fair amount of experience. And what I can say is to try to contextualize and normalize what many of you might be experiencing in this new landscape. It is very challenging to go from seeing clients in person to seeing them via video all at once. Usually, there's a learning curve involved with, just learning how to navigate the world not only of technology, but how do you connect and socially engage through a screen? And it's a little bit different than it is when you're in the same space with your person. So I want to just acknowledge to all of you who may be feeling challenged right now, stressed, fried after your first couple of weeks of working this way. It is completely natural that you'd feel that way because it's a muscle. Video conferencing work is a muscle that we really have to condition ourselves into growing. And many of you have gone from full-time in-person loads to full-time online loads. And that is a really hard transition to do all at once. So, some thoughts about that. What I would say is it is very possible, even though I understand the demand is high, your clients are extremely stressed and anxious, and you're probably, seeing a higher demand than you have ever seen for people that need your support and your services, whatever it is that you do. That is true. And what is also true is that because this is a global context, all of us are impacted by the way in which coronavirus has shifted the landscape of our lives. All of us are impacted by the uncertainty of the time. All of us are impacted by social distancing and self isolating. All of us, or most of us, are impacted by the uncertainty of the economy. I want to remind you that as practitioners, you're still human beings, and your nervous system is also trying to navigate the incredible, unprecedented stress of the times while holding space for the people that you care for. And you're adding on to that this additional layer of your nervous system having to adjust to an entirely new format for interfacing, which requires you to listen in and to track signals in your clients and patients at a totally different level. And that is a lot to ask of your nervous systems all at once. So it's really possible that in these initial stages of adjusting our lives and how we do business and how we're of service, that some of you may need to reassess the load that you're carrying right now, to schedule yourselves a little bit differently so that there's a little bit more space in your day to take some away from screen time and to do some self-care. In other words, you may need to tend to your own self a little bit more than normal right now not only because you're carrying the load of global crisis, right, and holding space for your clients, but because you're also trying to adjust to a new format. So I know that that's a hard thing to say, and there are probably a lot of you that don't want to hear it. And that's okay. You can take it or leave it. But I want to just remind us all our primary job in holding space for people who are struggling right now is to make sure that we are in the most regulated nervous systems we can be in. Because more than anything we do or say, our ability to really be anchored in our own regulatory capacity is what's going to create that safety for the clients and patients that we're working with. And that is especially important when we're working through the screen because things are a little bit flatter when we're online through digital interfacing. There's just a different depth of field in terms of connection. So if you are working too much and your system is fatigued and stressed by too much screen time all at once, that extra layer of stress may inadvertently translate through in your sessions. So, just a couple of thoughts for all of you around this. Try to be kind to yourselves. It's a big adjustment to make all at once, and you may need to find a way to kind of scale back a little bit to allow yourself some flex space so that you can grow into a more full time load and be able to do it without straining your system. Because we may be in this state for a while. And so, the last thing, of course, we would want is for you all to burn out or for any of you to burn out doing what you're doing, right? So, just a little plug for awareness, self care, understanding that less might be more right now in terms of giving your nervous system the bandwidth it needs to adjust to all of these novel things that it's trying to incorporate and integrate. If you have thoughts or questions or comments about this, if you want to engage in deeper dialogue with me about it, you can find my contact information in the verbiage below this video message. For now, I'm sending you all a lot of care, hoping you're taking care of yourselves, and just expressing solidarity for figuring out how to navigate being a support person in times when our systems are also stressed and asked to stretch to new capacity. Take care.